Hi, my name is Mandy. I'm performing collecting a wound culture. I'm going to follow all GPSP guidelines, my 11 rights and my 3 checks. I'm going to knock on my patient's door, enter the room, perform hand hygiene. I'm going to introduce myself to my patient. I'm going to tell them the nurse taking care of them and that I'm there to collect a wound culture and get their consent. I'm going to ask their name, their date of birth. I'm going to compare that to the wristband, and I'm going to ask if they have any allergies I need to be aware of. Then I'm going to assess the patient for the possible need for any pain-reducing interventions, and if applicable, I would administer the medication as ordered. I'm going to perform hand hygiene. I'm going to put on some clean gloves. I'm going to use the push-pull method to remove the soil dressing. And if needed, I can apply some sterile saline to moisten it. I'm going to gently lift up on the edge of the bandage and gently push down on the skin to release the adhesive. I'm going to do that all the way around my dressing to free it. I'm going to grab the center, and then I'm going to note any type, note the type, the amount, the color, or the odor of any drainage on the dressing or on the wound. I would dispose of that in the proper bin. I'm going to take off my gloves. I'm going to perform hand hygiene again. I'm going to be careful not to cross over my wound. I'm going to put on more gloves. I'm going to grab my gauze. It's not expired, the package isn't damaged, it's dry. I'm going to open. I'm going to squirt in the preservative-free saline. I'm going to grab a piece of my gauze and starting from the top of my wound, working my way down, I'm going to do one swipe. I'm going to dispose of that gauze. I'm going to grab a new piece of the gauze. I'm going to go top to bottom again, wiping once, disposing of gauze, and a final time. I'm going to get my gauze and go top to bottom. I'm going to get my dry gauze, good date, package is intact, there's no damage, there's no water on it, it's dry. I'm going to pat dry the surrounding skin top to bottom. Get a new one. Do the same thing. Pat the bottom. And again, I would pat or dry the surrounding skin one last time. Also, while I was cleaning my wound with the preservative-free saline, I could have also cleaned from the center to the edge of the wound. I'm going to remove my gloves. I'm going to perform hand hygiene. I'm going to put on a clean pair of gloves. I'm going to grab my culture stick, checking the package integrity, and I'm checking the date, make sure it's not expired. I'm going to open my culture tube. I'm going to remove the lid. I'm very carefully going to remove my swab, ensuring that I do not contaminate it. I'm going to go into the wound. I'm going to press to collect a good sample. I'm going to make sure that I do not touch the wound on, touch the edge of the wounds with the swab. I don't want to touch that intact skin. I got a good sample. Very carefully, I'm going to insert the swab back into the container. I do not want to contaminate that swab. I would label my culture tube following the facility's protocol. I'm going to remove my gloves. I'm going to perform hand hygiene. I would immediately document that I collected the culture. I'm going to assess my patient for pain. If needed, I would do any pain reducing interventions. I would document that. I'm going to ensure that the patient's bed is in the lowest position. Then make sure they have their call light. I'm going to perform hand hygiene. I'm going to grab my culture tube. I'm going to close the door to provide privacy for the patient, and I'm going to take the culture to the lab.